Hi, everybody. Welcome. We're here. It's just a special SpeakuP collaboration with Health Hub Bali. And we have a wonderful guest today, Dr. Laurena Law, that we're going to have a great chat with very, very soon. So as you know from our Future of Health sessions that we do every month, which is Health Hub Bali collaboration with SpeakuP Monday. Now, you know that we've been looking very deep into integrative medicine. We've been looking into that whole series of, why Bali, why now? We've been looking into that whole series of, what makes Bali special? And obviously, we've been looking at, what Health Hub Bali does as a platform for basically giving you the choice to reclaim your health, the choice for you to have a personal or a personalized health journey through the network of allied professionals which are here around the world, but here in Bali. That's what Health Hub Bali is focused on. That's one level, and it's science-backed. Science-backed, and we're talking about health tourism. So on the one hand, you have wellness, and then which obviously Bali is very well known for. Then on the other hand, we have medical tourism, which Bali obviously isn't really in the medical tourism game as we sit, and health tourism bridges the gap between the two. So, Dr. Laurena Law, I was reading your bio before, and you strike me as such an interesting person because you've had such a wide experience when it comes to health, medicine, fitness. All the way, through being a fitness junkie, if I can call you that, and then to Muay Thai to a very high level, and then when it comes to this, medicine, health, the future of health, you seem to have touched just about every area of health that I can imagine. So this integrative approach, this personalized approach, using epigenetics as well, I've noticed as well, it really is a powerful combination. So maybe the first question might be, what started you off on this journey of becoming this outstanding health professional?
Well, firstly, thank you very much for having me on the show and for asking the question. And I guess my own journey started, basically because both my parents were medical doctors. And so I grew up surrounded by medicine and about textbooks on health and disease. And I was very curious about how my parents actually helped patients and how they helped the healing process. So I had also a curiosity about life and how things worked, and wanted to understand how to prevent people from getting sick. So then the obvious choice at the time was to go into medical school and learn how to do that. But in the process, it was interesting because the whole time I was expecting to learn about what makes people healthy. But I was being taught all the basic sciences, yes, but I was mostly focusing on how to diagnose disease. So it kind of left me with a little kind of gap in what I thought was my knowledge gap. And I didn't know much about nutrition because, to be very honest, and most people will agree that, most doctors will agree that actually when we're in medical school, you're not taught much about diet or nutrition or food. So I didn't feel prepared at all when I came out into practice on how to talk to my patients about that. And I felt it was my responsibility because when you actually look at a lot of the labels in health, you see, talk to your doctor before you take this supplement or go on this diet. And it's curious because I didn't receive that education or that knowledge. So I had to then go and search my own path, because it wasn't really a traditional path that I went into. There isn't one for what I do. So I think that's the reason why I continue to learn and to learn more information so I could be better at helping my patients with a lot more of the chronic conditions that we see now today that are so prevalent. And through that process, I understood that our conventional model of medicine is very good at healing acute infectious diseases and traumas, and it really was designed very well for that. But now people are living longer with ill health. I don't think we actually had a model on how to teach doctors or health practitioners on how to support that healthy aging process. So my whole entire practice and career has been a learning process from patients, from other doctors who are in this space, and also role modeling some of those things and applying those principles to myself as well.
You know, that part that you just mentioned about, you know, applying the principles to yourself is something that I've noticed about you already, right? Which just seems to be so prevalent, right? Because as you mentioned, you know, you have this health background, right? This fitness background, and as I mentioned before, I couldn't help it when I read it and I saw Muay Thai. Hold a second, a doctor healing people is like a Muay Thai champion. How does that work? That was my initial inference. But then thinking about it a little bit deeper, you know, there's a lot of, you know, quite often when I was growing up in the UK, in London, we had a family doctor. I grew up in children's homes, but that's another story for another day. But what I noticed was that the doctors very rarely look well. The doctors themselves very rarely look well. They look like they were in need of all of the advice they were giving to us. You know, get good sleep, have good nutrition, you know, make sure you have fitness, make sure you have this holistic approach to your own health. And then, you know, befriending quite a lot of doctors, I realized that it's very difficult for them to do that. The pace of life, the challenges, the amounts of new discoveries they need to be across. It's like they're practicing, but they're also still studying full time. So it was like, well, then how can they have the time to look after themselves? How can they have the time to practice self-care, self-love, and so on? So I guess the question then is that from that, you know, fitness perspective, so how did that all begin for you? Because I get that your parents were, you know, were in the business, let's put it like that. And in a way, you know, as kids, you pick it up, you know, it's osmosis, diffusion, all these wonderful words. But yeah, the fitness side, how did that come together? Where did it start?
So I have to admit that I was not a fit child. Growing up in an Asian culture and community, fitness was not really a priority. It was mostly your academics. Yeah. And I found myself very unfit when I went to school and had to run around an oval for a marathon. And firstly, I wanted to challenge myself. I'm always someone who likes challenges. So I took upon myself to challenge myself to become physically fitter. And what I realized was that it wasn't so much as running a marathon or those things that actually interested me in moving. It was actually going into a group fitness class. So the music and the community and having someone guide you through that process was very enjoyable. So actually, I then continued that fitness journey. Then I actually started and continued that throughout my medical training, and also through my medical career, because that was a way that I found that helped me to release stress. And so when I started seeing patients and they weren't moving, I started to ask questions around their physical activity, because that was something that we knew at the time was so key in managing chronic illness, was how much were people moving. And I got frustrated because all I was doing was I was just talking at them. And I got an opportunity to actually go through group fitness training. And I did, and I went through that, and I didn't actually even think about teaching group fitness at the time, but because the opportunity arose, I thought, well, one of the other aspects that I could help people through is actually putting people through their own journeys in a fitness class, that the same way that I actually started enjoying physical activity. So that's how I got into getting fitter, and the Muay Thai aspect was really just, and again, something which really helped me to improve my fitness. So I started doing that. I started doing it in groups. And then Muay Thai was one aspect of martial arts training. I was very curious because you're using your arms and legs at the same time. So I participated in group fitness competition. And it wasn't really combat. It was really just demonstrating the skills required for being fit enough to do the sport. So that was another enjoyable aspect, because I did it together with other people. So it was having that community of other fitness professionals help me with my journey and my own commitment to having this healthy habit. Because I think sometimes when we think we should be motivated, that's very transient. But making it become a habit is something that helped me continue to prioritize that. even though I might be very busy or doing different things and trying to learn, there's always one part of me that just doesn't feel right if I haven't gone for a walk or done something active. And it doesn't have to be at the gym. It doesn't have to be an hour. It can be really just 5 minutes.
So it's that healthy lifestyle, right? I mean, that's what it sounds like you're alluding to, or naming it actually quite directly. So then when it comes to the, as I mentioned, I read a little bit about your bio before, and I can see that there's so many different areas of health medicine that you've been involved in. So maybe can you talk us through some of those so people get an idea of just how broad you are?
Yep. So when we think about health, we think about not having disease, but it's beyond that. It's actually not just about not having disease, but having enough resilience physically, mentally, emotionally to deal with the stresses that come at us in this modern day life. Because we think stress is negative, but actually it can be a positive thing that helps us adapt and grow and get better at what we do. And there are things that we have to focus on when we're trying to build that buffer. It's kind of, when I tell people, it's kind of like your bank account of health. So whatever you put into that bank account will actually help you build that base so that if you ever fall sick or if you ever have a condition or an operation, you've got that buffer so that you can expend that when you need it. But you also have to contribute to it regularly. So the 6 areas that I actually talk to people about, and this is one of the 6 principles of lifestyle medicine, is firstly, it's your physical activity, movement. It doesn't have to be structured. It could be recreational. It could be even just doing housework. So movement is key. So the second is about eating, nutrition, and eating pattern. Looking at what are whole foods, what are nutritiously dense foods, whether it's plant-based, whether it's a combination of meat and plants. That's very personal. So we can talk about that, but understanding what the principles are important. And then the second thing is looking at your sleep. How are you sleeping? Not just quantity, but the quality of your sleep, because we know that's so important for recovery, for so many things, for immune system, for your brain health, for your cardiovascular health, for your metabolic health. And then the next thing is stress management. How are you managing your stress? What techniques do you have that work for you? Because there are so many out there. What have you tried? What resonates with you? What's worked in the past? What could we explore further? So that we can start to build that buffer. And then, the standard things that we know of, smoking, alcohol, dependency, all those things we need to address as well. And then finally, when you have that health, who are you going to spend that with? So it's having that community and that purpose and thinking, what are you going to do with that health and how it impacts you, and the real reason of why do you want to be healthy? Do you want to have a long life, but a healthy long life?
Just thank you for going through those 6. What I couldn't get by the bank account of health. I think that's such a great way to put it. Like there's something that, there's something visceral, something that hits you in a different level. When I think bank account of health, and I think a lot of people will be able to understand, that analogy, right? Because if you put money in, you can take money out later. Yep. And, if you don't put enough money in, unless you have an overdraft facility, like there's nothing there. If there's negative amount there, well, that's not a great thing to do, because then you have real problems going forward. So then, what would you say then? As some of the, looking at the future of health, what are some of the biggest challenges that you think that we need to start addressing now in order to really be preemptive in the diseases and the types of, you mentioned we're living longer now, but this to address this quality of life. So what things would you think are coming up now we should be aware of?
So the first thing that I think it's important for people to understand is that just because you're getting older doesn't mean you have to accept getting a disease or a condition. It's something that is preventable, especially the lifestyle-related ones. So I define that by saying it's cardiovascular disease, dementia, physical deterioration, and also sort of cognitive health and cognitive decline. So there are actual lifestyle things that you can do today that can help to minimize, mitigate, or even reverse some of these conditions. So it's not about waiting until you get a diagnosis. It's actually about tracking where you are right now in your health trajectory. So if you think about where you want to be, so I try to get people to visualize, say, okay, so we kind of know human potential is 125 years. Okay, maybe we don't get to 125, but say the last 10 years of your life, what do you want to be able to do? Do you want to be able to play with your grandkids? Do you want to be able to travel? Which also means you've got to have the physical capacity to get on a flight, get off a flight, go upstairs, carry your luggage, lift things. Do you want to be independent in your daily living? What is it that is meaningful to you, and who do you want to do those things with? So we start from that. And I think we have to all think about the future, because what we do today has an impact on that. Every little habit, every little change that you do today can have an impact. So I think it's hard for people to think about that because we're so used to thinking about the immediate of today. What do I have to do next? Okay, I've got to go to work, I've got to do these things, but we don't really think too much about how we want to age. So I think understanding that and understanding that there are baseline markers that you can do to know where is your hormone level, where is your inflammatory level, where is your metabolic health. Those are things those are metrics that we know can be optimized. So as you start to get older, you can track how you're progressing, so you can continue to make those changes. And they don't have to be things that you do they're not markers you have to do every month. They could be a yearly marker, getting blood work done once a year to know where you're at, and then doing the lifestyle changes and then rechecking again so you can see what's impactful and what's not.
Yeah. And then, so this whole, like personalized treatment, lifestyle medicine, as you referred to it, great name, like what have you found when we look at epigenetics and look at us, obviously this personal. I mean, firstly, I think it'd be good, how would you define epigenetics, and why would you say it's important? Mm-hmm. Yeah.
So epigenetics is a study of how genes interact with your environment, which means the changes and the choices that you make with your food, your physical activity, how you recover from stress, your sleep. That's basically how our environment can have an impact on the genes and how they're expressed. Because we can't change our DNA or our genetic code, that's what we inherit. However, we can modify how they are expressed. So it's kind of like a recipe book. You have all these recipes. So they're like your codes. But the page that you open and the recipe that you start to make, that's the expression of those genes. So then they express as your body weight, your energy levels, your metabolic health, how you manage inflammation, how your immune system works. That's actually all expressed through the choices that you make today. So that's kind of how I describe it to people who don't really understand genes. And that's actually quite unique to all of us. So you have a unique blueprint. I have a unique blueprint. What I do may not be useful for you, or it could be useful, but maybe it's not the main priority for you. So personalizing means that we find out what is your unique blueprint and how do we go about leveraging your strengths so that you have the best ability to optimize your own health outcome. So it's not a one-size-fits-all approach to health. It is very personalized and individualized because we now understand more about gene expression and epigenetics.
Wow. And so I think you've answered the question, but I want to, so people at home really get it. So why is that important now? I mean, I think we've been through this time where, health has been very general. Right, general practitioner, right, family doctor, but now we're entering this age, as you mentioned, in the future of personalized lifestyle medicine. So then why then does something like epigenetics play such an important role, and how would that affect people's daily lives?
So when we do studies, we look at the whole entire population and the outcomes of the population as a whole, but that doesn't always translate into an individual positive response. So why that's important is because when we give generic advice, it may not actually work effectively for one person. So we actually need to understand who the person is. And this is an area which also modern medicine is starting to realize in the area of pharmacogenetics. We understand that people with different genes respond to medication differently. So we need to understand the doses and how much and how to monitor these people and whether or not this really is the best approach for them. We can also see that certain drugs are going to work better for certain individuals. So this is where personalization comes in the allopathic disease management space. But in the health space, there's also more and more research that's coming up that's telling us that, certain types of people will do better if they have more frequent meals. Others may do better with less meals. Some may do better with different types of nutrients. So caffeine is a variable one. Some are really beneficial. Some metabolize it properly. So the way that we metabolize and interact with food is different. And this is really important because there are no population studies for that. So we have to empower ourselves with that knowledge. So knowing what your blueprint is will help you understand what do you need to, what are your strengths and what are your potential predictive negative outcomes. So how do we how do we have strategies around that to manage that risk?
Got it. And then when it comes to, we were talking about Tracy earlier on, and you met, I think, some time ago, and it's been 3 years since you've seen each other. So what in what you do? I don't want to lead you too much with this question, which means lead in the question, right? I don't want to do this, but so what would you say is a connection point, for you both? I mean, I see it quite clearly, but what would you say is your connection point between yourself, what you do, how you approach it, and Health Hub Bali?
So as a practitioner, I'm skilled in one area. I can't do everything. In fact, sometimes people are a bit confused about what I actually really do. So in the last 2 weeks, people have identified me as a counselor, a nutritionist, a dietitian, a bodybuilder, and a dermatologist. So I use all these principles, but I'm not an expert in all of them. And there are aspects of a person's health where I'm not trained to do. So I'm not trained as a physiotherapist. If they have pain or if they have problems with their mobility, I'm not trained to fully assess that. Or if they do have a condition that I've picked up in early screening about their cardiovascular health and they actually need further intervention, I'm not the expert to give them that. So actually, it's a collaborative approach. So having different practitioners and different doctors who are expertise in their area, they're credible, they're trained properly, and collaborating on a person's health, I think it's important because it doesn't belong to any one discipline. Mm-hmm. It's actually a multi-discipline approach. Yeah. And also people are complicated. We have an individual health history. We have to meet them where they want to start because it's also about the individual doing the work. So we also have to support that individual in making those changes. And the reason why I believe that this is a potentially great model is because it also takes people out of their usual patterns and helps them see what potentially could be a better pattern for them, so that when they actually go back to their usual environment, they can start to navigate and see how to incorporate what they've experienced in terms of health and energy back into their day-to-day. So it becomes sustainable. It becomes something that they actually see as a long-term impact, not just coming here and feeling good and then going back and then repeating the same patterns.
Just even personally, I'm a person who hasn't always cherished a trip to the doctor. And it's interesting, something happened the other day, and there's another person exactly the same. It's like, you should go. No, not going, So by the time we get there, it's something quite serious, right? So as you mentioned before, though, which I find interesting, and I love the way you said it, is this, even here in Bali, we have, a modality that basically says, look, this is a one-stop shop. This modality cures everything. It will rid the world of everything else. Just do this one thing. Come to me, and by the way, it costs a bit of money, so you might not have much left by the time you're done. but come to me, and so they get locked into these silos. And then I know that Tracy spends, I think once a week she's on a Zoom call with about 70 professionals from around the world and is very well informed. And I think part of that Health Up Bali platform is the fact that the latest information is made available to everybody as well. So you've got that network of allied health professionals, that personalized journey to reclaim your own health. And then, there's this certification level that comes next, which allows you to be comfortable as a patient that everyone is qualified to be able to do exactly what they need to do to help you on your way to reclaiming your health. But what would you say, though, as I always like to put myself as like the man who knows nothing, because quite often I don't, and I'm happy with that. But it's good because then no one gets left behind, right?
Yep.
So from the perspective of a doctor, let's go there first, and then as a patient, and then we'll get these two different perspectives. What would you say are maybe one or two or three of the biggest challenges facing, what we're talking about today, which is reclaiming your health, personalized journey, epigenetics empowered, individual, everyone is individual. Let's go with what their strengths and weaknesses are, and then be able to predictively analyze what sorts of things they're going to have problems with in the future, and how we can now make the plans now to ensure we can live until we're 125.
So I'll start off with the medical doctor perspective. And one of the things is that in medical education, we do need to focus a bit more about what are the evidence behind health. And I think doctors are often, at the moment, there hasn't really been any kind of focus on that area. So from the medical perspective, I think we can do better in training our graduates and undergraduates on, what are the metrics and how do we assess for help. And then the other thing is, from the practitioner perspective, is to understand where our limitations and boundaries lie, because we are not about doing everything. It's about finding and assessing where the need is, where the gap is, and who is the best practitioner for that. So really the model, like I go back to lifestyle medicine, is to have the supervising physician assess the patient, see where that gap is, and then refer them, assist in the referral process so they're able to go to the right person for the treatment that they need. So we need to have a bit more of a structured approach about what are our expertise and our knowledge and what are we competent in. And beyond that, we have to respect that there are limitations. It's okay to have limitations. We're human after all. And then refer them to the best person, because if the focus is on the patient, then it's about the patient's results and outcomes. And I think we need to be able to measure our success in the outcomes of our patients.
That's really good. Yeah, like so many things come up when you speak, right? Which is great. So the next thing is, you mentioned before, about doctors, face challenges too, because I think, where I grew up, it's this. Yeah, I think it's maybe a global trend. It's like we give our power away.
Yeah.
Right? If this person's wearing a white coat in front of me, it means that they've studied, it means that they've done all these things, and therefore I can abdicate the responsibility for my health and just say, well, look, they're going to give me something, right, that's going to heal me, and I'm going to be back bigger, brighter, bolder than ever, and so on, right? So this... from that patient perspective, what as a patient, what are our responsibilities, do you think, to ensure that this whole thing works together?
Yeah, so I think as a patient, it's important to find information that's credible, that's reliable, and it's science and evidence-based, and to advocate for yourself by being an intelligent consumer of health. So it means, yes, the doctor is trained specifically to manage your disease condition. But at the same time, you've also got to recognize that, unfortunately, at the moment, hopefully this will change, that they're not necessarily the people to go to when it comes to a healthy lifestyle, because the information is a bit too generic. Until we have the ability to train to become more precise in our recommendations, I think right now, consumers and patients need to be able to go to reliable resources to read up on for themselves and educate themselves on what is the evidence behind this and what is the biggest lever that you can take, because I think we also need to kind of get over the idea that one pill is going to help us. None of this actually is in a pill. I say this, and this is the truth. If it was in a pill, it would be magical. I wouldn't have a job. But it's not about taking one pill or that magic bullet. In the 20 years that I've helped people, it's not one thing. It's not one thing you take. It's actually a series of steps that you decide to change, or a habit or a goal. It's about you taking control of that, because you see a doctor for maybe 15 minutes, half an hour at most, maybe 60 minutes if you see me. But what do you do for 23 hours of the rest of your day? Because that's very impactful. Yeah. So identifying where that gap is and working with someone who understands the priorities for that and where you're missing in that sort of area of health, and then finding a coach that's going to help you make those small steps, because sometimes we think just knowing is putting things into action. That's not always the case. Once you fill that knowledge gap, the next step is, how do you now change that habit? Because we're all used to habits. You know, we walk in a room, we see there's Coke right in front of us, we drink it. But it's, going against that sort of pattern and habit, breaking that, it takes time. It takes practice, and you need someone to guide you, and you have to be accountable to that person as well. It's a skill. Yeah.
There's, like I said, when you speak, things come. Thank you. One of the things is this. So there's a beautiful guy here that you'll meet maybe next time you're here. Name is Janur Yasa. And Janur is a great guy who invented this plastic exchange Bali, where it's about basically taking plastic and actually, instead of dumping it, it's putting it in recycling, right? But he has, much like you, a martial artist's mentality, which I think is brilliant. And, so what he says is that he's not, I'm going to quote you now, Janur, maybe not correctly, but I'm going to quote you. What he's saying is that it's not about the plastic, actually. I mean, ultimately the outcome is, but it's about changing the habit. That's at the core of it. And the way that he likens it is to like learning a new move, martial artist. So, you do this move 100 times, you have some kind of recollection of it. You do it 1,000 times, now it begins to come like in the groove, right? It can be something which I'm aware of, and I kind of know that I should be doing it. Yeah. You do it 10,000 times, now it's in your subconscious and it's a habit. So this whole plastic exchange is about that, creating the habit. If you touch plastic 4 times a day, then after a week, after a month, after a year, and these are where the results can then be seen, right? And the habit is changed, and that's the key. So I hear this in what you're saying as well, which brings a smile to my face, because I think it's such a great analogy, and that's. Again, I look at people and I know that people they go to Google, right? Dr. Google, right? Myself included sometimes. And they have a look and say, okay, well, I must have this. And then I'm going to go to the, to the pharmacist, and I'm going to get this drug, and I'm going to try it myself. And it's a trap, it's like, well, how do we then, find encouragement, incentive, as for people like me, like patients, to actually say, you know what, I'm going to go and see, a health coach in a way. And I mean, that's obviously what Health Hub Bali is. It provides the things that you've mentioned, which I get the connection point. Health Hub does, right? So it's literally, like a health coach who's guiding you through that process, which will not be stuck in one modality. It will traverse the modalities needed for you to reclaim your own health in that very personalized way. And then, because I mentioned, she's on calls every week, 70 doctors from around the world, she has this ability to disseminate the latest science-backed information. So it's not an opinion. It's science-backed, so it's been
Yep.
peer-reviewed, which is great. So then all of these things, I can see, more and more and more how it does make sense, right? So then what have been, you've mentioned the challenges for the doctors, mentioned the challenges for the patients, but why doesn't the world see it like this? Because it makes perfect sense. Yet we still have this old system of, I go to the doctor and he steers me in this direction and I take the drugs and away I go. So why is that still the case if this does, in fact, make so much sense?
Well, I guess when you're in the area and talking to health practitioners who are on the same vision, and I apply this to myself too, for us, it makes sense because we're in the field, we're in the industry, we're getting the latest information and science outcomes and studies to tell us that, yes, we can do something. But often when the research is done, it takes decades to translate that into something that's understandable and tangible for the patients and for society as a whole. So that type of work takes, it takes time because we have come from a different age where people weren't living that long, so we didn't really have to think too much about that. But also, it was very much about siloed approach, very separate approach to health. And at the time, it helped us understand more about the human body. So yes, it was very helpful, but now we're going back into understanding who the person is, and that takes time to evolve. So we're at a point in time where we can start to reframe the way that we think about health. And, even the talk about health is not just about not having disease. It's not obvious to the majority of people or general population. But when you talk about how do they want to age and what do they want to do, that's something that they understand. So we need to start to have more discussions about what that means, because that definition is evolving. And so as we start to get media and social media and different sort of platforms to talk more about this, I think more and more people will hear more of it and start to think about why is that important for them.
And, we're here in Bali, and I think you're in between Hong Kong and Australia or something.
Yep.
Firstly, how often have you been coming to Bali for?
Well, prior to the sort of restrictions, I was here at least 2 or 3 times a year.
Yeah. And then, so what role, kind of like this, why Bali, right?
Yeah.
That's really the question. So what role, does Bali play, do you think, in, adopting and supporting and embracing this kind of approach? And also as a place to have these kind of conversations that matter, which is, what this is called, the future of health, conversations that matter.
Yep.
So how do you think Bali ties into all of that?
From my personal perspective, coming to Bali, the experience was very unique. I had just felt that there was a sense of peace and calmness in the space, and just being in nature was just on its own very healing. And then discovering over the years of coming here that there are practitioners who really are passionate about what they do in the healing space made me think about it being a potential, a great center for people to come to take themselves away from a toxic or negative pattern that they might be in, and then finding and experiencing what it means to have health and have energy. So that was the reason for myself personally why I came here, was from time to time to also be kind to myself. As a health practitioner, I needed to be kind to myself to have the energy to then help my patients. So without that, I think I'm not really role modeling what I'm actually telling people to do, how to manage their stress and all those things, and prioritizing health. So for me personally, that was the reason why I came. And then having met Tracy through Health Hub, I could see how the changes here, and also her collaborating with different authorities on making that change. I think with the support of that, there's a great potential for it to be really successful and a place for people to come to heal and to get the best of the treatments that's personalized to them.
You know, we've so I've been in Bali for 6 years, 2 kids, wife. We're all here. Love it. We love Bali. It's interesting the points you mentioned. You know, during this time. So this is episode number 9 of the Future of Health, and we do one a month, right? So the first Monday of each month. Obviously, this one is not a Monday; it's a special one.
Yep.
It's just the two of us. We don't have the audience. You know, but it's been phenomenal. You know, because we started, you know, this journey with, you know, like, why is this chronic health? You know, we're supposed to be living longer. We have more, you know, technological advances. But then why is it that the quality of our life is suffering? You know, and then we went from that through each month is a panel. You know, through the panel of experts. I remember Professor Gelgel Widdasutta. He is the so what is he? He is the advisor to the governor of Bali for Balinese medicine and Balinese wellness. And I remember, you know, during this interview. And by the way, if you want to watch this series, which you should, go to SpeakuP. So all one word, SpeakuP Monday on YouTube, and you'll find the SpeakuP Monday Robert Ian Bonnick, and go into the playlists SpeakuP Monday, and you'll find all of the 9, or the 8 plus this one tonight, be 9 episodes of the Future of Health. Really important that you watch them. A different panel each week, from biome to gut to, I remember Dr. Dan Beelan as well. We spoke about him earlier on, the alpha thermodiagnostics and the alpha scan, but so many incredible minds, incredible souls have been amassed here in all areas of health, talking about this future of health, which has been amazing. But, you know, but the thing that I've recognized and noticed this running theme through it, which Professor Gelgel kind of put a finger on. You know, Bali does have this, you know, these 2 ley lines of energy underneath it, which create this force field, or create this like the heart chakra of the world, right? And that in itself is enough to calm the nervous system. So when we come to Bali, we just naturally feel this sense of rejuvenation, wellness. Like, I want to start again, right? You know, like, so many people here who have come to relocate their soul, right? Or their heart, right? And you see them everywhere. Ubud, not only just in Ubud, but, you know, so Bali has this wonderful way of supporting us to be more and to become more and to tap into, tune in, to go deep and to reclaim our health. Now, the thing about Professor Gelgel is I asked him this question, and it was something like, you know, what is one of the most important contributing factors to our health? Now, at this point, I was in the back of my mind expecting him to say, you know, meditation, yoga, Balinese tradition. I was expecting that, and he goes, no, it's how you think. It's your thoughts. Because as you know, mind, body, spirit, you know, it works in reverse. So like words become flesh, how you think is what you become. So just a question from left field, as most of them are, as you can see, right? So when it comes to your thinking and that being a determinant of what happens in your body later, you know, like what comes up for you when I talk about that?
So the thought process is important, and we actually do understand a little bit about how your perception of whether something is stressful or not has changes in your physiology. And we know that actually there is an epigenetic component to that. So we're starting to discover a little bit more about some of the genes that are triggered by stress and how we perceive stress, and also how certain types of mindfulness practices can actually help to alleviate that. And really, we're just starting to understand more and more about it, but it looks promising. And I think that's definitely something which is important in any kind of health journey, is to understand and know that you are in control. You're in the driver's seat. Yes, you may need some guidance, like a tour guide on that journey, but you still hold the power to make those changes. And I think it's about that. It's about showing people what their options are. That changes, you know, for example, like what you said, I fear going to the doctor because I might find something terrible about me. But actually, if you go to someone who actually helps you identify something early on so that you have the best chance of recovery, of managing it, or even in some situations reversing it, why wouldn't you want to know?
Yeah.
So it's not about getting bad news, it's about also getting what options there are. And there can be many different options. So knowing earlier means that you have a longer, better chance of being able to combat this. So mindset is definitely important. And, yes, it takes hard work, but anything that's of any value does take hard work.
Yeah.
And you will value it more because of the experience that you've actually gained and learned about yourself through that process. So definitely, I think mindset, mentality, perspective is something that we all we assume that we have, but sometimes maybe we're in a situation where we need to basically see it from a different, observe it from a different perspective, because our minds can play tricks on us all the time.
That's
Yeah.
right. All the time. All the time. So look, as we bring this one to a close, there's a question that I'd love to leave you with, and then we'll give you a bit of time to think about what answer you might like to give. And if it's reiterating something that you've mentioned already, or if it's something that you haven't spoken about yet but would like to, feel free to do so. So, excuse me. So the question is, like, what would you like to say? And I'll give you a little minute or so to think about the answer. So what would you like to leave people with, right? So we've had this whole, this great conversation, today about reclaiming our health, about integrative medicine, about lifestyle medicine. Let's use that word more, and the role of medical or practitioners and professionals, the role of patients playing part in this process. We've spoken about this journey of the health guides, right? We've spoken about obviously Health Hub Bali, who have obviously brought this all together, Health Hub Bali and SpeakuP Monday, and and the fact that these answers Health Hub Bali is providing, which is wonderful, and that's so. By the way, on that note, remember Tuesday talks every Tuesday at Health Hub Bali. So if you're here in Bali, you can go there in person, and that's Pereiranan or Pereiranan, depending how you want to pronounce it. So every Tuesday, and we go deep into these talks. So Tracy has someone, a practitioner, a professional coming in to really go dive deep in a workshop type environment. So you have that. And remember, Monday coming up, which is in a few days, it feels like we have the future of health coming up, and that's number 9. So be sure that you come and you watch that panel or tune in also. So look, so back to that question. So what is it, that knowing everything that we've discussed today, what is it you would like to leave people with?
Well, I like to let people know that you don't necessarily have to be ill to start investing into your health. The best time to start is early on. And how we do that is actually even just if you're from the age of mid-30s, okay, I think going to see your health practitioner, checking your blood pressure, just knowing what that is, because there are no signs and symptoms early on. And if money allows or you can afford it, just a baseline panel of very basic metabolic bloods to look at your insulin, your glucose, your lipids, because all these things matter in terms of your heart health, your brain health, your kidney health, your metabolic health, how you manage nutrients. Getting baselines of this, regardless of whether or not you have symptoms, and then doing it every year, because then you start to see a trend for yourself. That's what I would suggest. And now we have these wearables and technology that actually measures your sleep, measures your resting heart rate. Look at how the things that you are doing, whether it's exercise, food, even the impact of caffeine, alcohol, is impacting on how well you're sleeping. So understand your own individual response to these things is something that you can do today, so that you can start to learn more about how do I sleep better, how do I improve my environment so I can sleep better. And then just looking at whether or not you're actually doing enough physical activity. And then if you have a goal, beyond just moving, then go and find someone to get the right help. Because you can Google all you want and you can trial and error, but investing in a professional that actually has the credibility, credentials, and experience to guide you on it is going to help you cut a lot of corners and stop you from making a lot of mistakes. So that's kind of what I would like to leave the audience with, is make it an investment.
Dr. Laurena Law, it's been fun. Thank you for being such a great guest and being open and honest. And you're kind of re-engineering. When I say doctor, you're kind of re-engineering what that looks like for me. Healthy, conscious, sharp, smart, all the rest of that. So thank you for spending the time, and I'm sure people have got some great value from what you've had to share today. And most appreciated.
Thank you so much. Thank
you very much indeed. Okay, guys, we'll see you next week. Thank you, Guzman, Tropical Nomad. Look forward to seeing you soon. Thanks very much indeed. Bye for now.